So the other sector that really we're very interested in the moment in HCC is immuno-oncology, like everywhere else. And checkpoint inhibitors are really becoming more of interest and better understood in that space. We know of data already that's been reported by many investigators in regard to the combination of anti-PD-L1 plus anti-CTLA-4, or anti-PD-L1 alone, or anti-CTLA-4 alone. A couple of studies are still ongoing. One of them is we have a trial in progress poster at ASCO this year, which is looking at the combination of anti-PD-L1 plus anti-CTLA-4, Tremi plus Medi from MedImmune/AstraZeneca versus Tremi versus Medi. And this definitely is going to bring in a lot of wealth in regard to the information that comes along from that perspective. Other studies, however, worth noting, despite they are not necessarily being in trial progress at ASCO, but there is a very critical study that's based on Anthony Al-Kuwairi data on nivolumab in the HCC arena, and that showed a quite impressive response rate, and with suggestive also for improvement in outcome. There's currently a phase 3 trial of nivolumab versus sorafenib in HCC that no doubt everybody is waiting for the results of.
There's also something coming up this year about PHOCUS against sorafenib. Have you seen anything coming out of that?
So PHOCUS is again a trial in progress study. This is a very complex but fascinating area of interest in oncology and in HCC specific. This is a vaccinia virus, which is a altered smallpox virus that actually has embedded in it a altered mechanism of tyrosine kinase that normal cells will not react to, but it can disrupt cancer cells and at the same time replicate and destroy further cells. Data in the past have shown that at a certain number or amount of vaccine units or virus units, you can actually show an improvement in outcome compared to a lower unit of viral load. With this said, a trial has evolved from certain understanding of the mechanism of interaction between sorafenib and PHOCUS, and as such the current randomized trial is looking at sorafenib as a single agent, which is a standard of care, versus PHOCUS and sorafenib in combination. Another story that's evolving that we don't have the results of yet, and this hopefully will come very soon, is regorafenib in the second line setting. This is a study that looked at regorafenib, which is a multikinase inhibitor, same like sorafenib, in the second line setting after failing sorafenib. That's quite fascinating because this data, at least by a press release, is reported to be positive. We don't know the results of the data yet, but no question is very intriguing because that space of second line setting has rather failed, unfortunately, with many very genuine attempts with different therapies with different targets. However, it's quite fascinating to see that a multikinase of the same family of sorafenib is successful in the second line setting. This is a story definitely highly recommend to follow once it's come out.